Hello, everyone. Good evening. Welcome again to our Facebook Live on nursing prioritization and delegation. It's Thursday and it's 9 p.m. here, Pacific Standard Time. And I'm so excited to get back again here and discuss questions on prioritization and delegation. So, in the last 2 weeks, we missed some sessions, and that's okay. But again, we're here tonight and we have prepared you actually more questions for tonight, and we'll be going over different questions. Okay. Now, I said in the comment section that our topic starts with letter P. So the topic for tonight is going to be pediatric nursing. So I'm not sure how good you are in terms of pediatric nursing. Okay. So before anything else, Matus Tribe, I want to introduce myself. My name is Mr. Alan Matus, and I am a nurse educator. I have been teaching students for almost 25 years, teaching NCLEX, and also currently I am a nursing faculty in a nursing program. And I also help students pass their nursing program and also their licensure examination as well. And of course, if you don't know as well, I am an author of a book that I published in Amazon. The title of the book is Simple, Fast, and Easy NCLEX Review. It's available in Amazon, and also it's now available in the Philippines in black and white copy. So if you want to have a copy in the Philippines, you can email matusnursingreviewacademy@gmail.com. Up to this time, the book has a 5-star rating in Amazon. Okay, so 5-star rating in Amazon. And everybody, if you like the book, if you have bought the book, if you can please give a shout out or a comment in the comment section how you find the book so far. So far, a lot of students like the book. So thank you very much, everyone, for those who have purchased the book, and congratulations if you pass your licensure examination because of that book. Okay. Now, another one, everybody, I would like to give a shout out to the first few people who came in tonight. So the first few people who came in tonight are the following. So Gian Torres, I'm giving you a shout out. Also, Galina Nikitenko, Alfred Asuncion Tablada, also Pasang Don Malama, Michelle De Rayuna Noriko. Hi, Michelle. How are you doing? She's from Saudi Arabia, I guess. Okay, Middle East. Also, hi, Gian. How are you doing? We also have Effie Nanya, Brandy and Rose, and also Gerwin Katubik. So a lot more people. Guys, thank you very much for being here tonight, and I really appreciate that. Okay, so before anything else, also, I would like to make an announcement. We are starting, or we are accepting enrollment at this time still, for the 10-day live comprehensive NCLEX review webinar, which is going to start in July 24 to September 25, 2021. It's a live webinar, 10 days every Saturday. That will be from 8 to 4 p.m. Saturday class. So if you want to master your core content, this is a class for you. If you graduated 10 years ago or 20 years ago, or a new nursing graduate, and you want to make sure that you know your core content before taking your NCLEX, this is a class for you guys every Saturday. That would be the live comprehensive NCLEX review webinar. I have a lot of students who have called me and wanted to find out if we have a face-to-face class. It may happen later on. We are finalizing the venue for our face-to-face class. So it's going to happen soon. Just keep on inquiring, everybody, and looking out for the schedule in our Facebook page or also our website. Okay, so the 10-day live comprehensive NCLEX review webinar comes with an online access, and at the same time, live webinar with a workbook. All right. Okay, so another one, another one is we have our tips and testimonials. So tips and testimonials will be from students who recently passed the NCLEX or the licensure examination. So I would like them to, or I would like you to get a little bit of a tip or some recommendations from those who actually passed the licensure examination. Okay, so let's see. All right, so we have so we have a testimonial from Justin, who is one of our students who finished the live webinar. So he said he emailed us, or he did a Facebook review. He said, to aspiring nurses from all over the world, I recently passed my NCLEX RN last Wednesday, and I would like just to share my struggle turned success, if you will. Prior to Sir Alan's 10-day online course, I had taken the exam 5 times with no luck on the Pearson view trick, and yes, it still works, guys. What professor helped me realize was that you cannot think critically if you do not know the general nursing content. And that was pretty much what helped boost my scores on New World by at least, I think, 25%. So basically, what I am trying to say is I am forever grateful to Sir Alan for providing me the refresher course I needed, since I honestly think I couldn't have done it without him. Once you feel ready to test, give yourself some time on UWorld and practice doing 160 questions a day, like I did, 4 sets of 40. You'll slowly begin to build that stamina. Anyway, thanks for listening and hope to see your guys' names on here soon as well. Much love and God bless. That would be Justin. So Justin took the NCLEX 5 times and finally he passed. So I'm really very happy for that because finally he has achieved his ultimate dream, which is to pass the NCLEX licensure. Okay, and also he said that you have to practice at least 160 questions as you're nearing the exam, and that is true. You're actually supposed to answer at least 100 questions every day. 100 questions. You study the content probably in the morning, and after you review the content, then you do your practice questions and make sure that you have breaks in between. Okay, so make sure that you eat properly, that you sleep at the same time, and do again practice questions so that you don't get exhausted. Okay. All right, so another one again for tonight, we have the free 90-day online access NCLEX review. Okay, free 90-day online access NCLEX review. So stay over after this session because we're going to announce the winner of the raffle. Okay. Next, of course, before anything else again, if you can please click the like or share button or subscribe to our channel in YouTube. If you're watching this in YouTube, everyone, I would appreciate that so that other students will also benefit from the session. You know, we have a lot of students who discover our YouTube and also this session, and they're really very happy because it helps them, especially in their critical thinking. So always remember that we have like 60 videos more than this is the 61st session now, so we have a lot of videos, and if you watch all of these videos that can help you improve your critical thinking, everyone, especially in delegation and prioritization, because you still have those kinds of questions in your licensure exam or NCLEX. Okay, so I would like to give a shout out to Joe. Hi Joe. Hi Joe Bogsky. Hi Joe, how are you doing? I miss you. One of my students also. Okay, so keep on reviewing and keep on trying, guys. Okay, now let's proceed to our first question for tonight. As what I have said, is going to be pediatric nursing. So we'll be focusing on newborns. Okay, so let's see, newborns or neonates. So let's see your knowledge about prioritization delegation for newborns, guys. Okay, or infants. So the first question for tonight. Okay, so the first question is, the nurse cares for several newborns in the nursery unit. Which neonate requires immediate intervention? A, the 6-hour-old newborn with cold skin and respiratory rate of 65. B, the 3-day-old newborn who develops slight yellowish discoloration of the skin. C, the 4-day-old newborn whose weight dropped from 7 pounds to 6.5 pounds since birth. And letter D, the 5-hour-old newborn who has a pink body but bluish extremities. Okay, so let's review again. The nurse cares for several newborns in the nursery unit. Which neonate requires immediate intervention? The 6-hour-old newborn with cold skin and respiratory rate of 65. B, the 3-day-old newborn who develops slight yellowish discoloration of the skin. C, the 4-day-old newborn whose weight dropped from 7 pounds to 6.5 since birth. Or letter D, the 5-hour-old newborn who has a pink body but bluish extremity. If you can put your rational, everyone, for your answers. Okay? All right. So let's see what will be the best answer, everybody. And tell me your rationale why you chose a certain answer. The nurse cares for several newborns in the nursery unit. Which neonate requires immediate intervention? A, The 6-hour-old newborn with cold skin and respiratory rate of 65. B, the 3-day-old newborn who develops slight yellowish discoloration of the skin. C, the 4-day-old newborn whose weight dropped from 7 pounds to 6.5 pounds since birth. Or letter D, the 5-hour-old newborn who has a pink body but bluish extremities. Okay? All right, so some of you answered A. I think most of you answered letter A. Some would be B. Let me see. But what do you think is the reason why? Okay. A, why you chose your particular answer, everyone. Okay. So the answer to this question, guys, let's make it quick. Okay. What's the rationale? The rationale is going to be, let's see. The answer is going to be, all right, let's show the answer, guys. That would be letter A. Letter A is the answer, guys. So most of you are correct. I think 99%, because the normal respiratory rate for the newborn is 30 to 60. So 60 is still okay. So what you have for is what you have is 65, and also the fact that the newborn has cold skin. One of the greatest concerns that we have with newborn is going to be what you call your cold stress. You know, cold stress is when the newborn is exposed to cold temperature, and that causes increase in metabolic rate. So cold stress is not good for newborns because it can increase the metabolic rate, can cause hypoxia and also hypoglycemia. And having a respiratory rate of 65 is abnormal. So the bottom line is that you need to know your normal vital signs for newborn. And one of the things that you need to remember in your NCLEX as well is to really know the normal characteristics of newborn. You know which ones are abnormal or normal during your assessment. Like your letter B, for example, letter B is considered to be normal for a newborn. 3-day-old. Jaundice or slight jaundice is normal. Usually on the 3rd day, that's okay. Now, if the newborn develops jaundice within 24 hours after birth, we discussed that before. You know, within 24 hours is pathologic or abnormal jaundice. So any jaundice that happens very early after birth within 24 hours is not normal. Okay. Now, letter C. Loss of weight is normal for the newborn. We have what you call your physiologic loss, weight loss. Physiologic weight loss, which is the loss of weight in newborns at least 5 to 10%. Okay, usually on several days after birth, and then the newborn will regain that later on. Now, the reason for the physiologic weight loss or the normal weight loss in newborn is because of the passage of meconium and also urination. But later on, the newborn will regain the weight. So letter C is okay. Now letter D, the 5-hour-old newborn, pink body but bluish extremity. That's what you call acrocyanosis. Okay, and acrocyanosis is normal after birth. Actually, acrocyanosis can extend even up to 24 hours. You know, so it's okay for newborns to have a pink body and then bluish extremity because of the delayed circulation that happens after birth. So that's okay. All right. So in your UPGAR score, you actually put acrocyanosis with a score of 1. Okay. So B, C, and D are okay. The answer is going to be letter A. All right. Okay. So let's have the second question, everyone. Okay. The second question is, the nurse performs routine assessment and care of an Asian neonate after birth. Which of the following findings needs the most immediate attention? A, flat and blue-gray marks on the lumbosacral area. B, visible peristaltic waves observed after feedings. C, white pearly-appearing bumps on the roof of the mouth. Or D, the passage of thick and dark green feces during diaper change. Okay, let's read the question again. The nurse performs routine assessment and care of an Asian neonate after birth. Which of the following findings needs the most immediate attention? A, flat and blue-gray marks in the lumbosacral area. B, visible peristaltic waves observed after feedings. C, white purely appearing bumps on the roof of the mouth, or letter D, the passage of thick and dark green feces during diaper change. Okay, all right. So the nurse performs routine assessment and care of an Asian neonate after birth. Which of the following findings needs the most immediate attention? Okay, what do you think? And you can put your rationale too. Why is it that you chose a particular answer? You know, I know that you can see the answers of some of the people in the sessions. However, I would encourage you to rationalize. Why is it letter B, C, or D? But why not letter D? By why not letter C? And by why not letter A? You know, before you look at the answers of your classmates, I would like you to avoid looking at their answers first. Okay, just read the question first and decide on your answer, everyone. Okay. So practice, don't look at the comment section immediately. All right? Okay, so let's see the answer, everyone. One of the challenges that you have for pediatric nursing will be definitely knowing the signs and symptoms of different disease conditions. So which ones are normal or which ones are abnormal for newborns, for example. Okay? So put your final answer, everyone. The answer to this question is going to be letter. Okay, so letter B is the answer. Very good. So all of you, most of you, or I think all of you put letter B, which is the answer. You just passed your NCLEX examination. Okay, so that would be letter B because visible peristaltic waves would be a sign of pyloric stenosis. Pyloric stenosis, which is a disease condition among infants. Okay, it's characterized by that manifestation. So letter B is the answer, guys. Okay, visible peristaltic waves. What are the other signs of pyloric stenosis? Pyloric stenosis is number one, characterized by projectile vomiting. Okay, projectile vomiting. So that's one sign. Okay, so let's see what you have here. Okay, projectile vomiting. Then you also have palpable olive-shaped mass. Okay, on the abdomen. The one aside from that, the vomiting, you also have the visible peristaltic waves observed after feedings. You can also have abdominal distension. Okay, all right. Now, letter A is not the answer because A is a normal finding among Asian newborns or African American newborns. You call that your Mongolian spots. You know, very common among Asian Americans or Native Americans or African Americans or African descent. Now, your letter C, the white purely appearing bumps on the roof of the mouth, that would be your Epstein pearls, and that would be expected in a newborn. Epstein pearls. Now, letter D, the passage of thick and dark green feces during diaper change. That's the meconium, so that's expected. Okay, all right. So let's proceed to the next. So we have here a photo. So pyloric stenosis again is a condition characterized by the narrowing or spasm of the pyloric sphincter, and it's in the photo. What happens will be because of the hypertrophy or the narrowing caused by hypertrophy that leads to the milk. The milk may not be able to enter the small intestine. So the milk accumulates in the stomach and then it causes forceful vomiting or projectile vomiting. So that's the main problem in pyloric stenosis. I always tell students that in pediatric nursing, you will be hearing different disease conditions that you have never heard before. The most important thing is to study the pathophysiology of the disease and really understand what's going on, and then make sure that you understand the signs and symptoms of the conditions. Okay? All right, so that's all about your pyloric stenosis, everyone. Okay? All right. So, okay. Let's go to number 3. Okay, hold on, everyone. So number 3. Okay. I think I missed the question. Okay, so we have number 3, everybody. Are you ready for the next question? Okay, number 3. A mother asked for information about pyloric stenosis. So here you go. Okay, so which of the following statements about this condition are true? Are true. So I already gave you a clue what pyloric stenosis is all about. Okay, so let's see if you can answer this correctly. Select all that apply. A. The child vomits bile-stained greenish fluid. B. Visible peristaltic waves can be seen during assessment. C. Surgery is performed immediately to correct the problem. Or D. The condition is caused by hypertrophy of the pyloric sphincter. So select all that apply. Okay? Mother asks for information about pyloric stenosis. Which of the following statements about this condition are true? Select all that apply. A. The child vomits bile-stained greenish fluid. B. Visible peristaltic waves can be seen during assessment. C. Surgery is performed immediately to correct the problem. Or D. The condition is caused by hypertrophy of the pyloric sphincter. So what we're learning here is that we're learning about pyloric stenosis, but I hope that it is a wake-up call or a clue to everybody that, again, in the licensure examination, it's all about knowing your content. Okay, you cannot cherry pick which topic to study for the NCLEX. You don't want to say that I just want to study med-surg, I just want to study maternity. No, you have to study everything. Okay, especially pediatrics, because you don't really know what topic will come out. So sometimes you're lucky that there will be infection control questions, of course, because that's in the test plan, but sometimes you will have topics that you really should have studied. Okay, so what do you think is the answer for this question? This is select all that apply. Okay, what do you think? Okay. Final answer. So before anything else, also, I would like to give a shout out to the following students who joined the class. Pratexa Patel. Hi, Pratexa. How are you doing? Okay. Jerwin Katubi. We also have Michelle Noriko. Hi, Michelle. Okay. Joe. Kenneth Foster Walker. Emma Domingo. We have Kadiato Troali. Nadu, Garcia Leon, Mulo Hadera, Minakshi Joria. Okay, then we also have okay, so the answer to this question, everyone, without prolonging your agony, the answer is going to be, let's see. Okay, the answer is going to be, all right, so it's going to be letter B, C, and D. Okay, B, C, and D. So your letter A, let's go first to letter B. So letter B, of course, is present in pyloric stenosis. Letter C, surgery must be performed. The name of the surgery in pyloric stenosis is what you call pyloromyotomy. Okay, so we call that pyloromyotomy. Okay. Pyloromyotomy is a minor procedure that involves making small incisions in the abdomen to open the narrowing, okay? To open the pyloric sphincter. Now, letter D, the condition is caused by hypertrophy or spasm of the pyloric sphincter. So the hypertrophy or the spasm causes the narrowing, okay? Yeah, that's correct, Jerwin. You know the Frederick Ramstedt procedure. Yes. So the goal is to open the pyloric sphincter, everyone. So the answer is going to be letter B, C, and D. A is not included, and the reason for that is because in your pyloric stenosis, it is non-bile-stained. Non-bile-stained. There's no bile because it's not really coming from the small intestine, it's coming from the stomach. So it is non-bile-stained vomitus. Okay? So that's the answer, guys. B, C, and D. All right. So let's go to the next question, everyone. So congratulations for the ones who got their answers right. So we have Garcia Leyan, you got it right. Congratulations. Okay, so Leyan got it right. Abidemi Sola, congratulations, she got that right as well. Okay. Okay, so let's have number 4. A child is admitted with celiac disease. Symptoms of this disease includes which of the following? Select all that apply. So remember, celiac disease is one of your pediatric disorders, right? So celiac disease, select all that apply. Letter A, malnutrition. B, buttock atrophy. C, greasy fatty stools. D, ribbon-like stools. Or E, abdominal distension. Select all that apply. Okay? A child is admitted with celiac disease. Symptoms of this disease includes which of the following? Select all that apply. A, malnutrition. B, buttock atrophy. C, greasy fatty stools. D, ribbon-like stools. Or E, abdominal distension. So what are the signs of celiac disease? You need to understand the patho again, or the pathophysiology, so that you can pick the right answer. You need to know what's going on. Okay? And when I teach students in the class, usually I give them exercises to master the different manifestations of diseases, especially with pediatrics, because the symptoms are really confusing, especially when you talk about gastrointestinal conditions. So if you know the pathophysiology of celiac disease, somehow you will know the answer to this question. Okay? What are the symptoms of celiac disease or typical characteristics of celiac disease in children? Okay, so we have okay, very nice responses here. So Vibrant is here. Okay, who else do we have?
Okay, so we have
Okay. Mulu. Riza. Hi Riza, nice to see you here. Okay. Riza is reviewing for her NCLEX RN exam. So let's get to the right answer, everyone. See, put your final answers now, everyone. Put your final answers. Okay. So the answer, everybody, is going to be, let's see. Okay. So I'll give you a clue, everyone. What's the main problem in celiac disease? Can you remember? Celiac disease is a pediatric or is a disease condition caused by intolerance or allergy or hypersensitivity to gluten. Okay, gluten, which could be found in barley, rye, oats, and wheat. And the main problem or the main pathophysiology is that the presence of gluten leads to an immune reaction that results into the destruction of the microvilli in your small intestine. The microvilli are the structures very important to absorb nutrients. Okay, so the answer, everyone, is going to be, okay, it's going to be letter A, letter B, letter C, and letter E. So we have malnutrition, we have buttock atrophy, greasy fatty stools, and abdominal distension. So again, the reminder for tonight or the takeaway, know the pathophysiology of the disease, what's going on. So in celiac disease, what happens is that you have an immune reaction related to intolerance or allergy to gluten, and that leads to destruction of the microvilli. So if the child is unable to absorb nutrients, malnutrition will happen. Okay. Buttock atrophy is a typical characteristic of celiac disease. Greasy fatty stools because of undigested fats. Because the microvilli, destruction of the microvilli leads to inability to digest your fats, and that leads to steatorrhea. Everybody knows what steatorrhea is, right? Steatorrhea is your frothy, bulky, pale, foul-smelling stool because of undigested fats. Okay, and then letter E, you have abdominal distension, which is a classic appearance of a child with celiac disease. Now, your ribbon-like stool, everyone, ribbon-like stool is found in a ganglionic megacolon or Hirschsprung's disease. Hirschsprung's disease, which is another disease condition that we will discuss later on. Hirschsprung's disease or a ganglionic megacolon. So you have ribbon-like stools, or also your intussusception can also cause ribbon-like stools. Okay, so the answer is A, B, C, and E. Okay. All right, so let's go to another question, number 5, everyone. Okay, so number 5, a 6-week-old infant. So let's find out first who got the right answer in the previous question. The answer for that question was A, B, I think D, and E. So I forgot what was the answer, but let's go to number 5. A 6-week-old infant is brought into the emergency room due to projectile vomiting, visible peristalsis, and a palpable olive-shaped mass in the abdomen. And we all know this is pyloric stenosis, right? Based on this assessment, which problem is of highest priority? A, altered nutrition. B, altered elimination. C, fluid volume deficit. Or D, impaired gas exchange. Okay, a 6-week-old infant is brought into the emergency room due to projectile vomiting, visible peristalsis, and a palpable olive-shaped mass in the abdomen. Based on this assessment, which problem is of highest priority? Which one comes first, everyone? Okay? What do you think is the answer? Which nursing diagnosis or nursing problem is going to be a priority? A, B, C, or D? Which one comes first? Based on this assessment, what is your priority? A, B, C, or D? Okay, everyone, put your final answer. We will see who gets the correct answer for this number 5 question. Okay, for this number 5 question, the answer, everybody, is going to be, okay, very simple. That would be letter C, fluid volume deficit. Very good. So, fluid volume deficit. So, 6-week-old infant. Remember, 6-week-old. That's really very young. At the same time, you have projectile vomiting, and that leads to dehydration. Altered nutrition maybe, but dehydration comes first. Altered nutrition has something to do with weight loss, malnutrition. Now, some of you may answer letter D. You know, some of you will choose letter D. Oh, airway is always a priority, but it's not in the situation. There's no indication that there is an impaired gas exchange happening in the situation. If in a situation it says that the child is having difficulty breathing and the pulse ox is really very low, then you can say that you have impaired gas exchange. Or for example, you have cyanosis, then that becomes a priority or letter D. However, in the NCLEX, always remember, answer what the question is asking. So in the assessment, you have projectile vomiting. So the priority for this one is fluid volume deficit. Okay? So just remember that, guys, fluid volume deficit. It's not always airway. You always have to go back to the situation. Okay? So congratulations for those who got the right answer to that question. Okay. Next, question number 6. Okay, we actually have 100 questions for tonight. Are you ready for 100 questions, everyone? This is going to be a 24-hour Facebook Live. Are you ready? Just kidding. Okay? All right. So let's have the next question, everyone. The registered nurse or RN assigns tasks. So let's have delegation now. The registered nurse or RN assigns tasks to several unlicensed assisted personnel or UAPs in the neonatal unit. Which of the following are appropriate tasks to delegate to the UAP? Select all that apply. A. Observe maternal-infant interaction during feedings. B. Swaddle the neonate after diaper change. C. Place a cap on the neonate's head. D. Check for creases on the soles of the feet. Or E. Apply triple dye on the umbilical cord stump. Okay. Again, the registered nurse assigns tasks to several unlicensed assistant personnel or UAPs in the neonatal unit. Which of the following are appropriate tasks to delegate to the UAP? Select all that apply. A. Observe maternal-infant interaction during feedings. B. Swaddle the neonate after diaper change. C. Place a cap on the neonate's head. D. Check for creases on the soles of the feet. Or letter D, or letter E, apply triple dye on the umbilical cord stump. Okay, let's see. I know that a lot of students are really getting better and better with delegation questions. And I think that that's good because in the NCLEX it's much easier for you to answer the questions. Okay? All right? So what do you think is going to be the answer? A, B, C, D, or E? Loretta De Leon, you're late for tonight, and that's okay. Clara Annie, I'm giving you a shout out also. Another shout out will be for Gerwin. Let's see. Victor John Peter Galamgam. Emma Guerrero. Abimbola Olaton Boson. Okay. Abidemi Sola. Hi. Elizabeth Ekpan. Kenneth Foster Walker. Micaela Fuentes. Okay. All right. So let's see. The answer to this question, everyone, is going to be, let's see what's the answer, guys. Are you ready for the answer? The answer is going to be, okay, so you have letter B and letter C. And you put the rationale why B and C is the answer. Why is it not A? Why not D? And why not E? B and C is under the scope of practice for UAP. The swaddle the neonate. When you say swaddle, it means to wrap. Okay, and that's okay. Letter C, to place a cap on the neonate's head to prevent cold stress, and that's okay. So B and C are okay. All right? Now, your letter A is not to be delegated because observation of maternal-infant interaction, your bonding, that requires a licensed nurse. We want to make sure that there's proper maternal-infant bonding after birth. So observation is a form of assessment, and that needs to be done by the registered nurse. Of course, if the UAP notices something wrong, okay, accidentally, then the UAP can report. But the observation of maternal-infant bonding, which is part of the assessment of the emotional response of the mother, that would be for the licensed nurse. Your letter D is another assessment, so that would be checking for creases on the soles of the foot for maturity. Then that would be letter D. That would be for the licensed nurse as well, or the RN. And letter E, apply triple dye in the umbilical cord stump. Then that has to be the licensed nurse. Again, in this session, we always say RNs do not delegate EAT: evaluation, assessment, and teaching. Okay, so the answer is going to be A. It's going to be B and C. All right, so we have the rationalization by your classmate Pasang Dolmalama said A and D is assessment, E is a complex task. Yes, E is medication administration, so that should be, licensed nurse. All right, so are you ready for our last questions for tonight, everyone? I'm really very sorry if we have to end, okay? It feels sad, but we have the last question, number 7. We usually only have 4, but for tonight we have 7 questions. So count your scores, everyone. So the last question, again, is going to be about delegation. Okay, delegation to the LPN. Which of the following tasks may be delegated by the registered nurse to the licensed practical nurse when caring for a neonate immediately after birth? A. administer vitamin K injection. B, perform APGAR score assessment. C, check the rectal temperature. D, withdraw blood for PKU testing. And E, apply erythromycin ointment on the eyes. Again, which of the following tasks may be delegated by the registered nurse to the licensed practical nurse or LPN when caring for a neonate immediately after birth? Select all that apply. A, administer vitamin K injection. B, perform APGAR score assessment. Okay, another one, we have check rectal temperature. D, withdraw blood for PKU testing. Or E, apply erythromycin ointment on the eyes. Okay, so again, what's the answer to the question? Is it A, B, C, or D? And then you can put your rational again also. Okay, rational. Okay, so the answer is going to be what, everybody? The answer to this question. Okay. Which ones can be delegated to the LPN? Which task? Okay. So this is caring for a neonate immediately after birth. Immediately after birth. Okay. So the answer to the question, everyone, you have different answers, everybody. Okay. Let me see. Okay. This is a tough one. Yes, it is. We'll find out. Okay. All right. So the answer to the question, everybody, is going to be letter. Okay. That would be letter A and letter E. So C is not included. So that would be A and E. Congratulations to Elizabeth Ekpan for getting the correct answer. Elizabeth, congratulations. You got the correct answer, A and E. Gian Torres, congratulations, A and E. Shay Cool Kid, also A and E, congratulations also. Okay, for getting the correct answer. Okay, now why do you think A and E is the answer? A, that would be medication administration. That would be within the scope of practice of the LPN. Your letter E, apply erythromycin ointment on the eyes. That would be within the scope of practice of the LPN also. Okay, A and E. Now, why is it that B, C, and D are not included? Are not included. Okay, letter B definitely is not included because that's assessment, APGAR score assessment immediately after birth. Assessment should always be done by the RN. Okay. Next, checking the rectal temperature. That should be done by the RN. You know why? One reason why the rectal temperature is taken after birth is to assess for the presence of imperforate anus. Imperforate anus means that the anus is closed. So that is assessment, and that must be done by the RN. So checking the rectal temperature to check for the patency of the anus also. So letter C is an assessment, and that has to be done by the RN. It's not only vital signs taken, but then that has to be the RN. Okay, to check for imperforate anus. And then letter D, withdraw blood for PKU testing. That's an assessment. Another one, LPNs do not withdraw blood unless they are certified. Unless they are certified. So the answer is going to be A and letter E. I want you to go back to your lecture on maternity nursing. You know, why is it that we check the rectal temperature immediately after birth? So some hospitals are not doing that practice anymore, but some hospitals are still doing that practice. Okay, so the answer is going to be A and E because medication administration, oral, injection, topical that would be within the scope of practice of the LPN. Okay, so that's the answer, everyone. So I hope you learned something for tonight. Okay, so we have 7 questions. So can you total all your scores, everyone? So let's go now to, I want to give a shout out to my program. So if you're interested, we have Matus Nursing Review Online NCLEX Academy. Okay. This is a our program has the following features: interactive core content review, highly organized and up-to-date test plan-based curriculum, NCLEX Success Workbook. So it comes with a workbook, so you have to buy that separately. So we have subscription programs, and then also you can buy the workbook if you want. Study plan checklist, hundreds of end of lessons quizzes after the topic, final NCLEX predictor exam. So we have 2 of those. We have recordings for the Facebook Live, so you can watch all the recordings if you want. And then also we have our Facebook group, everybody. Okay, so just visit our website, matusnursingReview.com, and click online NCLEX review, and it will bring you to our website and the different products. Or you can also send us an email at info@matusnursingReview.com. Okay, or send us a message, everyone. Another one, if you want to be part of the Matus tribe, you can buy our inspirational products. So we have the steel tumbler, positivity, I can do it. We also have sweatshirts, we have cups, we have everything. So you can just go and visit to our website again, matusnursingReview.com, then click on the tab for merchandise products, so you can buy these products, guys. Okay, thank you. And then lastly, the last time we had our Facebook Live, our winner was Josephine Martinez. So give her a big shout out, everyone, for winning our 90-day online NCLEX review. So again, thank you very much, everybody, for being here tonight. Just put your comments in the comment section. I'll be reading them later on, and I'll be answering your questions also in the comment section. Okay, and again, just a reminder, everybody, our live webinar will start in July 24. We're still accepting enrollees if you're interested. And then also stay safe, everyone, and I'll see you again hopefully next week. Thank you very much, everybody. Put comments, and thank you also for your participation. If you pass the NCLEX because of our program, let us know so that we can give you a shout out and congratulations. And again, to all of my students there in the comment section, thank you for being here tonight. I miss you all. Thank you and have a nice night.